It's been said that organizations that have no problems actually have a big problem. We're a great program, but we're not perfect. We're always looking to improve, asking ourselves, how can we be better today than we were yesterday?
One of the main draws in the interview that I had was about the program's ability to recognize its own ways it can improve. It's something that I've seen actively as we've gone through, is that first off, they'll address it by name. They'll say, hey, this is what's going on. This is what everyone has given us feedback about. And then they'll hold meetings. They'll do town hall meetings where the residents can voice their concerns, and there's actually an open forum of discussion. This program has at its core the idea that we shouldn't be static, that every moment, if there's something that's going wrong, let's fix it as soon as we can.
The whole program is kind of structured towards improvement.
Residents are constantly encouraged to give feedback. And usually when you have feedback about something, it's not that you just tell somebody and then nothing ever happens. It's almost always either responded to in some way or incorporated into better changes.
We're never afraid to tackle the issues, kind of confront them head on, and constantly are working on improvement.
So a few years ago, we made the transition from our typical DRIP system to a geographic system where teams were kind of located with their patients in specific hallways. And that had a lot of positives, but we learned it also had a lot of drawbacks. And we've spent the last year making huge changes to that in a really safe way, using great data, feedback from residents, feedback from patients, and from our nursing staff as well.
The program has really good internal structures and foundations. We have, of course, Dr. Worm, and then previous chiefs who've also stayed on as faculty now. And anytime there's an issue that needs attention, I always feel like their doors are open and I can walk in and talk to all of them.
Whenever there's something that needs to be improved, we really want to have the residents involved in that. And usually it's coming out of what they're asking for, which is really important. I think having that open, honest communication. We're really big about transparency, so making sure that the residents feel comfortable coming to us, but that we're also communicating back to them.
The basic thing I've seen happen is someone complains to our chief residents that something is wrong. The chiefs are right next door to the resident lounge, and so you can literally just walk over and say, hey, this weird thing just happened and I don't really like it.
We like this to be a democratic process, and so residents get to be part of these groups and be part of the improvement that they see in their residency.
I think it also gives a lot of power back to the residents. So instead of just coming with a complaint, they're actually thinking about this in a systems way. So why did that handoff not work? How can I make that better in the future? And what do we do to make that change?
Just a couple weeks ago, we started kind of this new role for one of the interns, and I was on nights. And after a couple weeks of that, I kind of sat down with the chiefs, went over what was going well, what wasn't going well, and a couple other of the residents kind of agreed with me. And within a few days, they'd kind of changed some of the things around to make it better for everybody, and I think it's already improved.
Our chiefs are incredible. I can actually give you a really cool story about this. So I just got off nights, which can be a really challenging rotation for interns especially. And they were making some tweaks, trying to figure out how best to operate the night float program. And I just went in one morning when I got off work and I said, hey, these are the kinds of things that I think would be really helpful. And two of our chiefs just sat with me and talked through it, and the very next week they made those changes. It was crazy getting to see my feedback be translated so quickly and efficiently into changes that actually will impact other people in the program.
We found out that a lot of the admissions would come on later in the day, so people would get absolutely crushed at the wrong times. So we brought this up to our chiefs. The chiefs were working with the hospitalists over at the VA. They were constantly looking for feedback and titrating exactly how the flow of admissions would go throughout the day to try and offload any sort of abnormal stress or times of hardship for the teams. I think what's really cool is because they were so concerned about the nature of the admissions and kind of how to triage them appropriately from the VA, they actually came up with a position for an attending to help kind of triage and guide the workflow of admissions.
There was an outpatient activity called the A-Train, which was our way of kind of getting some experience with outpatient world, because a lot of our outpatient experience is through the long block. And what they did was they would have us go to the clinic every week and shadow one of the providers or do some acute visits and that kind of stuff. But it was pulling us away from inpatient. We were still expected to be responsible for things such as like pages and that kind of stuff. So it was really difficult to kind of be in that position for 2 hours. And we presented this to the leadership whenever we had a town hall. We do regular town halls with Dr. Warm and a lot of the APDs. And while we voiced this, they decided, okay, you know what, we've heard that this is not working. Let's figure out a way to make this better. What would you guys want to be your experience? And so we created this thing together with the leadership called ABC, which is Ambulatory Boot Camp.
The way that we iteratively try and improve things here was really helpful when it came to COVID and when that became a huge problem where we really had to learn quickly and make a lot of changes quickly.
In this program, particularly Dr. Warm, is really into hearing from the residents, and if something isn't working, he takes that kind of personally. So if something's not working, I mean, it definitely starts on a smaller level amongst the residents, and probably we start talking to the chiefs about that. And once it gets to the level of the chiefs and multiple residents have an issue with something, it'll definitely make it to Dr. Warm, and then Dr. Warm certainly loves to do some analysis and figure out why it's not working, and after that, if it seems like it's not working, then it'll be changed mid-year. It's not let's do analysis, okay, it's not working, we'll fix it for the next class. It's changed mid-year in the moment.
Our program has learned a lot through different QI steps, and that's been really helpful in terms of our leadership to address change in a positive way.
And of course, growth mindset doesn't only apply to residents, and I've seen a lot of our faculty open to feedback.
At University of Cincinnati, we are all about growth mindset, and with growth mindset comes improvement.